28 years in alternative medicine. Been practicing for 28 years in alternative medicine. My background is chiropractor, but I have been practicing for my entire career you could call it private practice, but I'm not practicing by myself. I have a medical doctor. I've been working directly within in our walls, medical doctors, nurse practitioners, physician's assistant. This has been my whole career, is working side by side with medical professionals. And also I've been fortunate to be able to lecture to probably somewhere around 20,000 medical professionals over the course of my career. And this is what I found. This very common concept that I think is missed is that the vast majority of medical professionals in this country really want to help people, but they are experts on disease processes. And I'm going to say this because it's the vast majority of them. I'm not saying it's all of them. I don't want to make a blanket statement here, but they're not experts on health. They're experts on disease. And what I've seen, again, this isn't a blanket statement because it's not all of them. I've seen a lot of alternative healthcare providers that are experts on health, but they also have a lot of knowledge and background and expertise on disease. Now, some of them don't. Some of them don't study disease at all. And that's a problem because you have to understand both. But I think that this is what I've seen. I'm curious what you've seen. If you're a medical provider, a healthcare provider watching this, leave me a comment. Let me know what you think. I believe that most of medicine doesn't know a blessed thing about what it truly means to be healthy. I would argue that they don't even know the definition of health that shows up in the medical dictionaries. I believe they are good experts on disease, and I think that that's important. I think that's knowledgeable. However, if you don't know what you're going for, which is health, how would you know if you ever achieved it? How would you know what health is if you don't study health, if you don't study how somebody is healthy? If you're just studying the absence of disease or the presence of disease, how do you know whether somebody's healthy or not? So I think a fundamental problem in our healthcare system is that Western medicine doesn't know a thing about health. Again, that's a stereotypical statement. And they only know about disease, the treatment of disease. And the treatment of disease does not produce health. You've got to look at what it takes to produce health in order to get health. And I just don't think that most of Western medicine does that. I think that if you're looking for health, you need to go to somebody who understands what health really is, how to achieve it. And that person who you'd be going to determine health would also have to have knowledge of disease. Because how would you know if there was disease that needed to be handled in order to achieve health? This is where I think that alternative medicine and Western medicine, or traditional medicine, so to speak, allopathic medicine, should work closely together. The problem that we have is that everybody's worried about their profits, all right? The traditional medicine, Western medicine, I mean, let's face it, it's the most profitable industry ever known to mankind is pharmaceuticals, and they don't want to give up their profits. And then you have alternative medicine that all they want to do is bash Western medicine, that's not the right thing to say either, because there's a time and a place for it. But anyway, patients come into our office all the time. We say, look, if you want to keep your chronic condition, do what your insurance says, because the insurance company is there to sort of feed itself, which is it's being itself as part of the medical system. So anyway, I'm just curious what your thoughts are on this. I think that there should be a much better dialogue between either a better dialogue or better education on the traditional medicine side, better education on what health really is and how to achieve it. They've got to really go for health instead of just trying to treat disease. Treating disease is vitally important. If I break a bone, I don't want to be brought to my office where nobody in my office is going to be able to set that and treat it properly or screw it back together and do a surgery. I'm going to need to go to the hospital for that. If I've had a heart attack or a stroke or something like that, understand I was already unhealthy if those things occur. I should have been doing things to stay healthy to prevent them. But let's say it did occur. I need to go to the hospital for that. Traditional medicine is great at those things. They're just not good at keeping people healthy. Anyway, curious what your thoughts are on this. I'm Dr. Dave Morse at Magnolia Medical Center and Functional Lab Hackers. Hope you have a great day, and leave me some comments below. Again, leave me your thoughts.